All right, you're welcome. This is Celebrity Pharmacologist, and today let's look at this simple clinical pharmacology question that is on the board. And the question says, a patient develops facial swelling, wheezing, and hives immediately after taking ibuprofen. What should the nurse do first? It's asking for call to action, like what should the nurse do first? Option A says give another NSAID. B says observe for 30 minutes. C says stop the medication and notify the provider immediately. And D says reduce ibuprofen dose. Now let's examine these options one after the other. Looking at option A, it says give another NSAID. These conditions that was listed in facial swelling and hives. Now, if you say give another NSAID, all NSAID has by inhibiting COX-1 and 2, the same route of which the ibuprofen followed. So giving another NSAID, it's not really going to help because they will still follow the same route, the same mechanism of action. Sorry. Now let's talk about B. B say observe for 30 minutes. When you're observing, it will be prolonging. The condition might even get worse. The condition will get worse. So observing for 30 minutes is still not going to be the option. Now let's just go to option D. Option D says reduce the dose. Reduction of ibuprofen dose is not really what we are talking about here because it's not overdose that is the issue here, but what the root, the mechanism of action rather. So ibuprofen, this option is not the correct option. Now, what should the nurse do first? Stop the medication and notify the doctor or the provider immediately. Then they will what? Introduce a drug that will stop these symptoms and change the ibuprofen to another class of analgesic. If you like this kind of video, please do want to follow the Celebrity Pharmacologist. And if you want to know more about drugs, there is currently an online pharmacology class, but it's not free. It's something you can also pay for. Please do well to share this video. Thank you.